Milestone in Massachusetts today. 1 million people now fully vaccinated. To discuss it with us is Dr. Shira Doron, hospital epidemiologist at Tufts Medical Center. Good to see you.
Good to see you too.
So we've got about 7 million people in Massachusetts, about 15% fully vaccinated then. Another 12% have had their first dose. What does that mean in terms of herd immunity and moving forward with relaxing of restrictions?
Well, that concept of herd immunity is so elusive. We don't know exactly how many people are already immune from past infection, and we don't know what number we need to get to with vaccination. And then there are all the young kids who won't be vaccinated for a while. But that doesn't mean that we won't see continued declines in illness, hospitalization, and death as we keep vaccinating as fast as we can, focusing on those who are most vulnerable to severe disease. And when the hospitals are no longer at risk of being stretched beyond capacity, we can really open things up much more than we already have.
You talk about opening up. On Monday, the state's travel order becomes an advisory or recommendation. What are your thoughts about precautions and about whether folks should even go if they get the urge to travel?
You know, the CDC and the Massachusetts Department of Public Health are still recommending against travel right now. Certainly, if you travel to a place with higher COVID-19 transmission, you're increasing your risk of acquiring the disease. But the other concern is that you could unknowingly move variant strains of virus from a place of higher prevalence to a place of lower prevalence and set off a cascade of transmission that could threaten the success of our vaccination program. So especially if you're unvaccinated, you should consider waiting until you're immune or until cases aren't quite so high in the community before you travel.
Keep that big picture in mind. Okay, want to ask you about this. The CDC making it official today, saying 3 feet of distancing is needed between kids and schools as long as they have masks on. Teachers, staff, and adults, though, still need to have 6 feet with kids or other adults. What's behind that difference? Is it simply the size of a child versus an adult?
Well, the 6-foot guideline that we've been using for society in the US is arbitrary. There's no line in the sand at 6 feet. Rather, the risk decreases on a continuum with increased distance. Now, many countries tell their citizens to maintain a distance of 1 meter, which is a little over 3 feet. Meanwhile, schools that have been adhering to a policy of 6 feet between children simply cannot fit all of the children in the school at once. So for feasibility, because of how important school is for the health and well-being of children, and because they're at very low risk for severe disease from COVID-19, the recommendation is now 3 feet for students and 6 feet for the staff inside the schools. And you know I agree with that 100%.
Yes, I know. All right, one more question before you go. Dr. Fauci saying today he believes the UK variant is both more contagious and also more deadly. More than 200 cases of that variant here. How much of a threat do you think that is in the progress that we're making?
Well, there's a lot of evidence that it's more contagious and mounting evidence that it could be more deadly. But the vaccines we have work equally well against this variant. And countries vaccinating quickly are seeing dramatically reduced infections, hospitalizations, and deaths, even where the UK variant is the predominant strain. So the key here is to keep transmission down with masks, distancing, avoiding large gatherings, and vaccinating as quickly as possible.
As quickly as we can. All right, Dr. Doron, thank you for your time and your insight. We appreciate it.
Have a good weekend.